I'm Clara Letty. I'm one of the nursing supervisors at RMA.
And I'm Agnes. I work on the marketing team at RMA. So this is all very fresh and new to me, but I'm excited to learn. And hopefully this will be really relatable for people who haven't done this or just need a refresher on how to use medications. So I'll be the tester today.
Perfect. Okay, so 3 medications that will be common in a cycle are Menopur, Gana Relics, and then Follistim. So this one gets refrigerated.
Okay.
And this is a multi-dose pen. So we'll show you guys specific dosages and how to dial up to your specific dose.
Okay, perfect. And these 3 medications are typically, or not typically, but they would be used all together. This is like a typical protocol for people.
Yeah, okay. Exactly. So most people start out night 1 to night 4 or 5 using Follistim and Menopur in combination. And then eventually we add on the Gana Relics later in the cycle once your follicles get closer to being ready to ovulate. And then it's roughly about 3 to 4 days of the Gana Relics before you take your trigger shots.
Okay, good. Good for people to know.
Yeah.
Well, why don't we go ahead and we'll start with the first medication.
Okay.
And again, this is being recorded, so you'll be able to see it on our website if you're not able to make the whole webinar.
Yeah, perfect. Okay. So let's start with Follistim.
Okay.
So this is, again, a multi-dose pen that will be dialed up. It comes in a separate cartridge that you'll have to put into the pen. So I will have you demonstrate how to do it. Okay. So pull the top of the pen off from the cartridge, straight out. Perfect. I can leave that there. And then it's going to come with this little cartridge that's refrigerated on the side. Okay. So now unscrew the top of this, so it's kind of like a pan. Yeah, exactly.
Oh yeah.
So pull that off. Yeah, so unscrew it totally, pull it off, you can put it there. Perfect. Okay, so see this plunger here, that's going to go downwards into here, and that's how we get it into the pen cartridge. Okay, so hold this.
Yeah.
Put the blue side, I'll swap with you.
Okay.
So put the blue side down into the pen. Yep. Yeah, exactly. And then you're going to take this plunger and push it into the medication. It's open on the top. And once you hear that, then you can twist it on tight.
Okay,
perfect. Excellent.
Not
hard. So now it has a dosing window at the top up here. So let's say your dose prescribed by the doctor is 150 units. So you're going to want to dial this knob until it reads 150.
Yeah, okay. So like 25, 50, 75, 100, 125, 150.
Perfect. Okay, so if you want to show that up there, it reads 150.
Probably can't see it that great, but it does say 150.
So let's pretend you go too far.
Okay.
So dial it up to, what's the next one? 175. Okay. So you're not able to dial it backwards. You're going to need to dial it the full way up. So pull the pen out until it reaches the full end of the cartridge.
Okay.
Push it back in and restart.
Oh, wow. Okay.
So this one, unlike the Ganirelix, which you've probably seen, is another alternative to the Follistim. That one you can dial backwards, the Follistim you cannot. So you need to redial and, start from scratch.
Okay.
Okay, so now that we're at 150, now we're ready to put the needle on. So it will come with these little pink topped BD needles. Okay, and it comes with this little protective paper covering, so you can just take that right off.
Okay,
perfect. Okay, and then it has like a sharp little needle at the end there. You're going to stick it straight onto the pen and then twist it tight.
Am I doing
that? You are.
And pull.
Yeah, perfect. Okay. So we'll keep this on the side because you'll need this protective little sheath here to recap once the injection's been performed so that we can safely remove the needle, and then it's good for, the next day. Because again, these are multi-dose pens. A typical dose that we'll prescribe for the Follistim cartridge is 900 units. So if your daily dose is 150, this pen is good for 6 injections.
And you said this stores in the fridge, so like you would just put it back in the fridge when you're done.
Exactly. Once we're done administering the medication, then you put it back in the fridge for the next day.
Okay.
So let's practice.
Oh, let's do it. Okay.
Well, we got it set up. We have our fake skin for you. Thank you.
Yeah, no one's actually getting injected.
Okay. on tight. Okay. So yeah, to self-administer, you're just gonna pinch the skin. You want to do 2 finger widths or so away from the belly button on either side. Usually when we're doing injections night 1, I recommend doing, Menopur on one side, Follistim on the other. In the extreme off chance you have a reaction, you know which one was injected where.
Okay.
So you'll clean the target skin like she just did.
Mm-hmm.
You'll take off this protective covering.
Okay.
And just put that on the side. And then when you go to do the injection, you're going to want to hold it up front so that you can see the dosing window. And that when this reads 0, once you push that down, then you know you've gotten the full dose administered.
Okay. And
so
again,
you'll pinch your skin.
Mm-hmm.
Yeah, pinch the skin, inject it straight in, and then push down until this reads 0 there. And you hear the clicking sound. That's how you know it's getting administered. And then we usually say wait 3 to 5 seconds after the full injection's done, and then you can release.
Okay. So
Perfect.
unlike some of the other fertility medications, like this needle is a little different than
So these are all about 1/2 inch.
Okay.
So similar in size to both the Gana Relics and the Menopur that you're
Okay.
going to be injecting.
Okay. Yeah, and not big at all.
No. Yeah. So you'll feel the initial like pinch of it going into your skin, but from there, once the medication's actually going in, nobody really complains about this one. The Menopur, people sometimes get a burning sensation from that one, so which we'll demonstrate next.
Okay.
Okay. So now that this was administered, you're going to take this sheath, put that back on, and then you're going to twist it the opposite way to take it off than you did to make it tight. Yeah, sometimes you gotta like pull with your finger. It can be a little finicky. Yeah, so then twist it that way.
This way?
Yeah, take it off.
Oh my gosh.
Okay. Again, these can be like a little bit finicky, so you're gonna recap it, and you can even like use your finger as leverage to just pull off.
Oh, I see.
The bottom one.
Okay.
So,
and that's trash.
Yes, and then this goes into your sharps container. You don't ever reuse a needle. You'll have plenty of needles to use for your next injection the next day.
Okay.
Okay, and then you'll just recap this and then put everything in the fridge for the next day's dose.
Okay, that wasn't that hard.
Does anyone have any questions about this medication specifically before we move on to the next?
Is there anything patients should keep in mind for this medication, all of them? Like, what about in terms of like alcohol consumption or certain foods they should be avoiding or anything lifestyle based?
Yeah, the medications in general are dehydrating, so we recommend replacing, during the whole cycle with a lot of water, a lot of electrolytes. You can drink alcohol in moderation. Most people end up just, holding off until the cycle is complete. But yeah, alcohol and caffeine in moderation is okay.
Okay.
And just, eating a balanced diet. There's nothing specific that we really recommend with that.
Okay. Well, why don't we move on to the next med? And if anyone has any questions that they think of, feel free to enter them into the chat. We'll get
exactly.
to
If anything pops up, just let us know. We can get to it.
Yeah.
Okay. So the next drug, which is the one most people are the most scared of, is Menopur.
What is the lore that everyone is so scared of?
So 2 things. One is reconstituting the medication. So people get a little bit anxious about, mixing the water and the powder.
Okay.
And then the Menopur has a burning or stinging sensation when it's actually administered.
Mm-hmm.
So this usually goes away within about 5 to 10 minutes. But, kind of work yourself up to getting a little bit anxious about it. So hopefully we'll,
so
ease into the process.
This one's a bit more of like a chemistry project.
Exactly. So some people actually find it fun. And that's the goal, is to have you guys enjoy the process as much as we can.
As much as possible.
Okay, perfect. So in this box comes the Q caps, which you'll use to mix, and then the actual Menopur vials. So each box will come with 5 waters. I'm out of this one, but it will come with 5 water vials and 5 powder vials. So let's say your daily dose is going to be 2 powder vials, which is a very common dosage the physicians will prescribe. So you're going to pull out 2 of the powders that say Menopur on it.
One, this one has like a peachy cap color.
Yeah.
And a second one.
Perfect. And then we're going to reconstitute 2 powders with 1 ml from the sodium chloride vial, and that'll be your pink top.
And each of the sodium chloride vials is 1 ml.
So it actually contains 2 mLs total in it. They always overfill most vials to give you enough, but you're
Okay.
only going to reconstitute with 1 ml from that. Even if you bump up to 3, 4, 5 powders, whatever your dose ends up being, you still only reconstitute with the 1.
Okay, got it.
Perfect. All right, so let's pop these caps off. And those can just go straight into your sharps container as well.
Okay. Great.
Okay. And so now we have to get this water into the powders. And to do that, we use this little tool called a Q-cap. So if you want to take that little protective paper off. And then there's going to be a pointy end on there.
Yes.
You're going to stick that straight onto the water or the sodium chloride. So if you want to keep it on the table, it's actually easiest to leverage.
Sure.
Because then you can just kind of pop it straight on.
Yep.
Perfect. Now it's popped on, you just take off the plastic.
Okay.
Great. Okay. So now that the Q-cap is attached, we need to take one of the syringes because we have to pull out this water and get it into the powder. So you'll have these 3 ml syringes that will come with your shipment.
Okay.
And we just want to pull up a little bit of air into the syringe to create a suction for you. So I recommend just pulling out about 1 ml of air to help us with the next step.
Okay.
Okay. So now you're going to twist that onto the sodium chloride Q-cap vial until that's tight.
Yeah.
Perfect. And now with your thumb, you're going to push down
All the way.
all the air into the vial. Now keep your finger on the plunger, invert the vial,
Okay.
and now draw out until this is filled to 1 ml with liquid. And you'll see if you notice here, there's a little bit of air, so you can pull out farther than you need and like flick out any air bubbles. You can tap on it, hit it on like the side of a table. It's not going to break. And then just slowly push up until that first black line is in line with the 1. Perfect. So see, now we're filled with just the liquid.
Okay.
Okay, perfect. Now I keep it in this position and just kind of crack it off to the side. Keep the Q-cap on, just take the vial and pull it off to the side.
Got it.
Perfect. So now we're done with the sodium chloride. You can put it in your sharps container. No more of that stuff.
Okay.
Okay. Now we take this 1 ml, hold it like this.
Will the plunger move?
It's not going to move.
Oh.
Now that it's out, the suction's like released, so it's not going to move.
I'm like holding it in. Okay.
Perfect. Now take this 1 ml and inject it into powder 1. So you'll push on the Q-cap until you hear that click. Perfect. Now push all of the water or the sodium chloride into the vial.
Done.
Okay. Now let's just do a little check. Check the actual liquid, make sure there's no particles. You know, there could be some like white particles that are trying to still get dissolved. Just give it a little twirl. So don't aggressively shake the vial, but you can kind of swirl it to make sure everything's absorbed well.
Looks good.
Okay, perfect. Now push all of any extra air into there. Same thing, invert the vial, and now just withdraw the entire contents of this syringe.
Okay.
Okay, great. And now we can flick this vial off.
Done.
Perfect. And now we have to put this onto powder 2.
So right, because we want to reconstitute 2 of the Menopurs.
Exactly.
Okay.
Yeah. So it's not multiple injections. When we say 2 powder vials, hold it here so we don't. Yeah. See. Okay. So hold on.
Okay.
Hold it from the body here.
Yep.
So you don't accidentally push the.
Oh, I see.
This here.
Yeah.
Yeah. So if you push down on that, then you're gonna get the medication everywhere.
Sure.
So just hold here and push from it. Perfect.
Got it. Okay.
Perfect. Okay. So now push all of.
Sorry, guys.
So now push all of the water
Liquid.
into there. That first powder reconstitution. Push that into there. Same thing. Give it a little twirl. Make sure everything's dissolved. Perfect. Okay. Finger back on the plunger.
Turn it over.
Yeah, exactly. So if you want to push that in a little bit to create your suction and then pull everything out.
Okay.
Okay, great. So now that this entire vial is into the syringe, you can take the whole Q cap off because we're done mixing.
Okay, so just twist it off.
Yeah. Perfect.
Done.
And now you're ready to do the injection. So this will be done with the 27 gauge 1/2 inch needle. Okay. So you'll take this needle, attach it onto the top. Perfect. And see here how we have a little bit of air. So any like bubbles you can flick out, tap it on the side of the table, that'll go away. And then we have some air here that we need to get out.
Okay.
So you're going to slowly push up on the plunger until you see a drop of medication come out at the top of the needle. Perfect. Okay, so now you know the needle's primed. You're not going to inject yourself with any air.
Okay.
And now you're ready to do the injection.
If in the instance there is like an air bubble, like when we go to inject, is that like going to be detrimental to anything?
No.
Okay.
They'll, again, flick them out, tap it on a table, they'll go away. But if you have a tiny little air bubble that goes in with the injection, it's not a problem.
Okay.
Okay. Okay. So again, we'll clean your target skin.
Okay.
And again, I recommend on opposite sides, just if you do get the burning from the Menopur and you don't want to constantly inject in the same spot, give yourself a break.
That's like a common side effect with this.
The burning, yeah.
Yes.
Yeah. I'd say 90% of patients experience it.
Okay.
And we're demonstrating on the lower belly, but you're also welcome to do the upper thigh as well,
Oh,
if
okay.
that's more comfortable for you.
Okay. Pull this
Okay.
out.
Yeah, so pull it straight away from you. So don't stab yourself. Perfect. And then same thing, you just want to hold it like a dart. Pinch the skin, inject straight in. Push down until the black meets the end of the syringe. Hold for 3 seconds. 1, 2, 3. And then you can release.
Okay.
Okay.
I feel like people probably get anxious about this one because again, it's like we're reconstituting 2 vials.
Yeah.
So there's extra steps. What if someone in the instance makes a mistake where like they put too much sodium chloride in, or they mess up in some way? What are their options? What can they do?
So usually what happens is people will take the full sodium chloride vial and just end up diluting. You're still getting 2 powders, so it's not totally incorrect. And sometimes it ends up being totally fine. The only way we'll know if we need to adjust the dose at all is when you come in for your next monitoring visit. So if it looks like we need to up the dose or tweak anything, that's why we bring you in so constantly. It's annoying to come in every other day to daily, but this is why we keep a close eye on it just to make sure everything's going well.
Right.
And if you're ever like, I don't know what's going on, I feel like I may be messed up, there's always a physician on call overnight that you can also speak to, and they can kind of walk you through the steps and see where we may have misstepped. But nothing is going to be so detrimental that you're going to ruin your cycle over it.
Okay, good to know.
Okay.
Okay, so now that we're done with this needle.
Yeah. So we would put it in the sharps container.
Okay.
Yeah, but you can recap it now so we don't step yourself.
Okay. Don't do this, just put it in the sharps container.
Yeah, exactly. Okay. Okay. Any questions? Okay, C1. Is it best to inject while sitting down or standing up? Okay, so good question. I usually recommend that patients sit down. I think when you're standing, you have a tendency to be like flexing or kind of like holding in, which makes the injection just a little bit more painful. And also when you're sitting, you can just kind of get a better grasp of it, the fatty area, but it is totally a matter of personal preference. But I think people prefer to either be laying down or sitting.
Right. And then if someone else is doing it for you,
yeah,
give your partner,
especially if somebody else is doing it for you, then you're not like backing away when you're standing when somebody's trying to do it, which also I've had happen at patient house calls and things like that. So
yeah. Okay. I think that's it for now. And again, if you have more questions, feel free to put them into the chat.
Yeah.
But I think let's move on to the final medication.
Yes. Okay. So I saved the easiest for last.
Good. Oh, but that was
they're not all terrible. Yeah.
I mean, the first one, like it's preloaded, so that's great. And then this one, it's a little bit of a science experiment. And then we'll do this one.
Yeah. Okay. One more question. I'm joining a bit later. You're also demonstrating injections for FET. We don't have progesterone injections on this one, but we will do a webinar for that so you guys can see. Happy to set that up with the next one.
Yeah,
that
we
have
can
going.
we can set that up. In the meantime, if there's any medications that are on your cycle right now that you're not seeing demonstrated today,
Yeah.
This video, along with all of our fertility medication instructional videos, are located on our website under the patient resources section. There's a fertility medication section, and those have all like highly stylized videos. So like when we're holding these things up close and you can't really see on those videos, you'll be able to see the label and the dosage. So I definitely encourage you to go on to those videos to watch them.
Yeah. Definitely. Can I get someone to do the injections for me? Partner, friend? I don't, of course. Yeah. So we always recommend if you have somebody that's able to help you with the injections specifically for progesterone, because it's kind of like a hard to reach area. And even the stim medications, if you know, you do not have to be a nurse to give the injections. Obviously, people do these themselves and with their partners or friends every day. So you're more than welcome to have somebody help you with it. You know, and we can walk you through the process anytime you come in for monitoring. If you want to do like a little demo, or we can walk you through how to do it, we're more than happy to do that during monitoring as well.
Yeah, there's lots of areas for support, both in person. And again, the videos are really good, everybody. Like, they're up close, you can pause them, so you can just do them in sync step by step with the video. So definitely tune into those for sure.
Yeah. But I know it's helpful to kind of like watch someone who doesn't normally do it and see how they kind of like, you know, play around with it, because it'll be similar to probably what, you know, you're going to experience and kind of hiccups that you might have as well. So yeah, I know it's, you know, nice to see it live too. Okay. And last but not least is the Gana Relics. So this is a pre-filled syringe, so really not much to this one. You just basically have to get the air out.
Oh wow, okay, so it's all filled.
So if any of you guys have done Ovidril before for an RE cycle, it looks extremely similar to the Ovidril. It's a pre-filled syringe. You take the top off, just remove the air, and then do the full injection into the lower belly. So pull that straight off. Perfect. Okay. And then you'll just want to pull down on the plunger to kind of loosen it, because if you hit the plunger up, you know, just straight off the bat, sometimes all the medication will fly out really quickly. So pull down on the plunger just a little bit. Perfect. Okay. And then now that it's loosened, just do what we did with the Menopur and slowly push up until you see medication come out at the top of the needle.
Any day.
Yeah, so you can see it here kind of moving. Okay, perfect. Oh, all right. Okay, great. So now we just saw the bubble come out. So now we know the needle is primed. Okay. And then we're going to do the same thing, just inject into the lower belly. So I will say for this one, the needle is a little bit, well, patients complain that the needle's a bit dull. So you might need to put a little extra force to get this one to pierce the skin than you do with the Follistim and the Menopur needles. Okay. Okay. Yep. So same thing, pinch your targets in, hold it like a dart, just inject straight in, push fully down, hold for 3 seconds, and then you can release.
Done. That was so easy. Yeah. And on this medication, would you ever be using only some of the dose?
No, with the pre-filled syringe, we would never say inject like a third or a half. There's no way to really titrate a specific dose with these. So we would give the entire thing. There would never be an instance where we'd have you do less than a full one.
Okay, that's good to know.
Yeah. So most people are prescribed about 3 to 4 of these for their cycle. And then again, we'll move to the trigger shot after that.
Okay. And then we put this in the sharps container.
Yeah. Full thing goes in the sharps. You use a new one the next day. Okay.
That was great. So we went over the 3 medications: Follistim, Menopur, Gana Relics. Gana Relics is a pre-filled syringe. The Menopur one, we reconstituted 2 vials, but I assume sometimes someone might be using just like 1 vial.
Yeah, you
Okay.
can be prescribed 1, you can go up to 3, 4. We don't usually see above 4 powders, but yeah, anywhere from 1 to 4 powders is probably a standard dose.
Okay, and then the Follistim was also preloaded, but that one depending on the dose you're assigned.
Right,
Okay.
so that one you have to take the cartridge and insert it into the pen, but once that's done, it will be preloaded for, future injections. So
Right.
depending on your dose. So again, if we give you a 900 pen, your daily dose is 150, that pen is good for 6 days. If your daily dose is 300, it's only good for 3 days. So we'll usually dispense a couple of cartridges that you can replace once that one's done.
Okay, perfect. Are there any questions before we wrap up this webinar? And Clara, anything our patients or anyone who's about to embark on this journey should keep in mind as they're like going through and starting the process?
During the process, our biggest things are, what we talked about with like limiting caffeine, alcohol, any like supplements that you want to take, usually acupuncture, if you're interested in that, is totally fine as well. The 2 biggest things are no intercourse and no exercise during the process. So you need to wait for a period to resume post retrieval to resume those activities. And most people get a period roughly 7 to 10 days after the trigger shot. So just timeline wise, that's what you can expect. It might be a little bit sooner than you're expecting your regular cycle to come.
Okay, good. Okay, great. Thank you so much, everyone. Thank you, Clara,
Yeah,
for
of
sharing.
course. Thanks for
Appreciate it.
being my
Yeah,
model.
no, happy to. So this has been recorded. We will get it uploaded onto the website under patient resources, and we'll also be sending anyone who joined today a link to this specific video for reference. So thank you so much for joining. I hope this was helpful.
Yeah.
Oh, one last question.
Oh, good.
Glad this was helpful.
Yeah.
Thank you so much for coming,
Yeah,
everybody.
thank you guys.
Really
Let us
appreciate
know
it.
if you have any questions.
Yeah, and have a great day.